I am Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we are going to go through a 60-second lower back pain relief hack. So I'm actually experiencing a little bit of low back discomfort myself. I was in Washington, D.C. over the weekend and decided to do some running and ran way further than I should have. But it was really pretty, the weather was great, and I was just enjoying the scenery. And around where I live, it is not flat, and DC was nice and flat, minimal hills, and I ran a little bit too far and then walked around a lot and then slept in an unfamiliar bed in a hotel, and I have been a little stiff and sore, and I have been on my feet most of today. It's been a really hectic day treating, so I'm going to go and show you what I'm going to do right now in order to relieve my back pain and relieve some of this discomfort that I have in my low back area. Before anybody says anything, this is what I do. Now, I do these things on a regular basis. There is not a day that goes by, for the most part, where I do not have foam rolling in my routine, whether it be just showing somebody at work or actually working on an area that is sore. I am on this foam roller all the time. So many of you, if you're just watching this, if you just got a foam roller with spikes, if you're just starting foam rolling for the first time, it may take you longer than 60 seconds to do what I'm about to do to help your back pain. You may take 5 minutes. Don't get frustrated because I'm able to eliminate a lot of my pain in a minute, and you're sitting there and you can't even tolerate these spikes. It took me a while to get there. So I did not film or video the months and the years that I've been doing this in order to be able to hop on there and relieve some of this. Also understand that I got back from Washington yesterday and I am taking care of this today. We're not waiting 2 weeks. I'm not waiting a month. I'm not popping some pills hoping it'll go away. I'm addressing it less than 24 hours after it happened. So a lot of times what we see and what we have to treat is injuries or pain or discomfort that has been ignored for quite some time. So I am not a big pill popper. I don't suggest you take pills. This is why, because treating it the day after, getting it worked on 24 hours later really cuts back on the time that it will take to heal. Me, I'll be better as soon as this is done. As soon as this is over, I will be feeling better. I might be a little bit sore from the roller, which is okay. Now, the caveat about these rollers, they can and will cause bruises. So don't be alarmed if you wake up and there's some bruising on your skin, especially if it's your first couple times. It's normal to have bruises. Doesn't mean you stop. Maybe you don't roll that area as aggressively the next day, but there will be bruises. So you want to make sure that you are just paying attention, taking note of it, but you don't really have to stop, or you shouldn't be discouraged, or you shouldn't be upset if you see a bruise form on your back or on your legs. So we're going to go through a 60-second hack to fix that lower back pain, and it's going to fix mine right now. So you're going to take your roller. I got black spike tonight. And all you're going to do is you're going to sit on it, and it's going to take me a minute to get down on the floor because I am a little bit sore. But all you're going to do is just start by rolling back and forth. Now, the one thing you want to understand is when I say your low back, you're not just going to sit on your low back and go back and forth. There's a lot of muscles that attach up into your low back. So really the low back's going to be a little bit of where we hit tonight. And when I'm showing you this, it is going to take me longer than 60 seconds. So if anybody's timing this, it will take me a little bit longer because I'm talking and demonstrating. But once you get really good and you get a sore low back, this will take you a minute to knock it out. Then I'm going to cross my one leg over the other. Now, this may not feel comfortable, okay? You don't want to ignore it, all right? This is a little bit more uncomfortable for me because I'm tighter in my hips, and there's a really good spot right there. So you just want to roll, again, all the way from your low back down into the bottom of your butt. And you want to go onto the sides as far as you can. And again, just stopping on some of those points. So there's a lot of them today because I am sore, all right? You want to pick 2 or 3. Do not spend your entire night trying to needle out these trigger points. Stop, keep rolling. Switch to the other side. Same thing. You want to roll all the way onto your side as far as you can, not ignoring your hips. Your hips and all these muscles come up and attach onto your low back. Again, concentrating on any trigger points that you find. You're then going to go and roll your hamstrings, because your hamstrings, if they pull on your low back, are going to be an issue. You're going to go cross one leg over the other if you don't feel it. Now my hamstrings aren't too bad. Okay? I'm going to go a little bit to the side to get a little bit of that IT band, just because I know I ran further than I should have, but that's not really involved in your low back. And then again, I'm just going to go here and roll. My hamstrings aren't really tight. My IT band is a little bit. And then I'm going to come back up here and finish off. That's it. Loosening up all of those muscles is going to help loosen up that lower back. I already feel better. I can feel a difference. Once you have the ability to feel the foam roller as a maintenance program as opposed to something where you get on and it hurts, this is going to be a really good hack for you to have, especially when you travel or you just wind up with a little bit of low back stiffness for the next day.